And welcome back. I'm Mabel, Jong. You're watching live coverage of the World Healthcare Congress coming to you from Washington, D.C. Our next guest has extensive experience as a physician leader in healthcare delivery systems, managing and developing new services line, and being part of senior leadership and helping with growth strategies. A big welcome to Dr. Bipin Mistry, Medical Director at Remedy Partners. Dr. Mistry, good to see you.
Thanks for having me.
So what is your general advice on how organizations can cut costs while still trying to bring value to the services that they're offering? You obviously have a lot of experience on both sides of that.
Right. Yeah. So there's a couple of strategies. I mean, I think understanding what a value-based landscape looks like, whether it's total cost of care or bundle payments. One of the things that I've noticed in the ecosystem is that total cost of care can drive it more on a population health basis. But when you really want to drive the high care costs, you really want to look at specialty-driven bundles. And that's what sort of I've been focusing on with Remedy Partners, is looking at bundle payments. And we've joined the government program, the CMS program on bundle payments, and we've shown tremendous results, showing that, this can be done, and it can be done at scale. And during that experience, I've faced physicians and hospital systems that kind of just get very nervous about entering this two-sided risk model and, trying to explain to them through data and trying to make them understand what their risk corridor looks like. You can start to sort of work with them and help them sort of walk down that pathway of value-based healthcare. In terms of total cost of care, as a physician, a lot of physicians don't know where the cost buckets are, Prior to joining Remedy, I did a lot of costing studies at the patient level, and it really gave me tremendous insight to understand, what does top of license mean for a physician? I mean, we're already inundated with doing the EMR, managing 30 patients a day and so on and so forth. Whereas, is that the most effective use? And I think in a fee-for-service model, you're kind of just driving volume. Whereas in a value model, you start to sort of look back and say, where am I creating value for the patient's journey? From the office through to the acute event or procedure through to the post-acute. So when you start to sort of break it down by those arenas of care and being transparent with your data and being transparent with costs, systems and providers and clinicians start to understand what's happening in those arenas and what could they be doing better. And then finally, you want to sort of show what the outcomes are. Right now, we're very much in the beginning of the journey of outcomes, which is claims-based. But, eventually we'll get there with patient-reported outcomes.
Well, do we already know that patients seem to do better with coordinated care versus going out and trying to navigate all the different providers themselves?
That is true. I mean, definitely the coordination is very key. I think having the coordination is one element of it. The other element is that knowing that there's a quarterback for your condition that is able to sort of cross the silos and say, hey, what are you doing in home health that's helping my patient? How best are you providing my care? And again, going back to what's right for the patient, not all post-acute care providers are the same, so you have to figure out what's the best. As a patient, as a clinician, I don't know. But through data, you can start to sort of say, okay, this group of home health providers do an excellent job for this condition, whereas this post-acute care facility might do a really good job for this condition. So you start to sort of bring more transparency into what the right care is for the patient.
There doesn't seem to be a shortage of data, but are we using it correctly?
That's a great point. I think as clinicians, you kind of get very critical of data. You're like, oh, that's not me. That doesn't make sense. But doing it, making sure that you prepare the data that's understandable for the audience is going to be very key, number one. Number two is that you want to lead with knowing that it's about quality improvement, care redesign. Use that data to help you drive the right decisions in care. An example of that would be that, we find that, patients that may have this type of risk profile may do okay at home with increased services. They don't need to go to a skilled nurse facility. Or if it's a patient that's going forward for a particular type of surgery, you can make decisions of, well, before you do that surgery, let's look at what your profile is and say, you probably do better if you stop this, reduce weight, let's optimize your plan before you hit the surgical table. So there's ways to sort of slice and dice that data and compare. Outcomes between patients. And then finally, competition is always great in the market, and having data to compare physicians allows the member to start to understand, what's happening. Maybe that's one step towards cost transparency for the member, and I think we'll get there. But I think it's going to be important that we use data appropriately, it's transparent, and that we can explain it. And
at Remedy Partners, how do you begin to work with your clients?
So in the CMS program, because it's a voluntary program, we will get claims data from CMS, and we will help partners understand what the data looks like based on the conditions and the bundles that they wish to participate in. And then we'll sort of present them with the opportunities around particular conditions. And then we'll talk to the partners at the local level. What can you do? What can't you do? Because all care is local. And then based on that, we can make decisions as to how we should participate. In a commercial space, it's similar in that you need the claims data to help drive what's appropriate for the market. And then in terms of what's appropriate for the market, you want to sort of drive it at the provider level. And what we do at Remedy is that we can help health plans administer the program, but we will actually be side by side with the providers in making sure they're successful in the program.
Okay, Dr. Mistry, thank you so much for stopping by. Really appreciate it.
Thank you for your time.
Thank you. And I'm Mabel, Jong. Thank you for watching. Stay tuned. We have many more interviews to come.